This video will demonstrate the tray application of topical fluoride on a patient. The use of fluoride provides the most effective method for dental caries prevention and control. Fluoride treatments are not limited to use on children. Many adults with a high caries rate or root exposure can also benefit from professional fluoride application. There are three basic topical effects of fluoride. Topical fluoride prevents tooth demineralization. It enhances remineralization of incipient lesions. Finally, topical fluoride maximizes resistance to dental caries by inhibiting bacterial activity. There are a variety of fluoride agents available for professional application: 2% neutral sodium fluoride, 1.23% acidulated phosphate fluoride, 5% sodium fluoride varnish, and 8% stannous fluoride. Acidulated phosphate fluoride is the most commonly used agent in clinical application. Professionally applied fluoride agents come in four delivery methods: gel, foam, varnish, and rinse. We will be demonstrating the use of the gel application in this video. The supplies needed for a professional tray application are one maxillary and one mandibular disposable fluoride tray, a 2x2 gauze square, a mouth mirror, saliva ejector, an air-water syringe tip, and a timer or wristwatch, and the appropriate fluoride agent that is based upon the patient's caries risk assessment. In preparation for the procedure, a rubber cup polish is not routinely necessary before fluoride application. A toothbrush is then recommended for biofilm removal. Review the patient's medical history for any contraindications, such as food and dye allergies. A detailed explanation of the rationale and procedure must be given to the patient. The patient will need to be instructed to avoid swallowing the fluoride during the procedure, and that the duration of treatment will be 4 minutes. Before starting the procedure, place a barrier over the fluoride bottle to reduce cross-contamination and to support the practice of standard precautions. A selection of fluoride trays is available for the clinician's use. There are two tray types that can be utilized, one for the maxillary arch and one for the mandibular. These trays also come in a variety of sizes: small, medium, and large. With gloved hands and the patient in an upright position, select the appropriate fluoride tray that will cover the patient's entire exposed enamel. The complete dentition must be covered, including the anterior and posterior teeth. Dispense a narrow ribbon of fluoride gel into the selected trays, no more than 1/3 of the tray height. Make sure to have the fluoride gel spread evenly throughout the tray. This may be done by pressing the sides of the tray together. The fluoride gel can also be spread by tapping it on a hard, clean surface. Another method to spread the fluoride gel is to use a cotton tip applicator. For easier access, it is recommended that the clinician place the filled trays on the bracket table before starting the fluoride procedure. Remove the patient's cup to ensure that the patient will not rinse after the trays have been removed from their mouth. Standing in the 8 o'clock position, the clinician will place the mandibular tray first. Holding the air and water syringe with your dominant hand, retract the patient's cheeks with the index and middle fingers of the non-dominant hand. Dry the patient's teeth thoroughly and remind the patient to stay open to keep the teeth dry. Make sure to dry the facial, occlusal, and lingual surfaces. Without removing the fingers, insert the mandibular tray over the teeth. Lift the patient's lower lip around the tray. The patient's head should be tilted forward at this time to avoid ingestion of excess fluoride. And a saliva ejector should be placed under the tongue. Standing in the 9 o'clock position, the clinician will insert the maxillary tray. As mentioned previously, the clinician retracts the cheeks and dries the teeth thoroughly before placement. Make sure to dry the facial, occlusal, and palatal surfaces. Without removing the fingers, insert the maxillary tray. Lift the lip over the edge of the tray. Once the trays have been inserted, ask the patient to close down and gently chew 2 to 3 times to ensure complete fluoride coverage. This procedure will need to be timed for 4 minutes using either a clock, a timer, or a wristwatch. The patient must never be left unattended during the procedure. After the timed 4 minutes, remove the saliva ejector and both trays. Because the patient has been instructed not to swallow or rinse, ask them to expectorate in the bowl. Utilizing a mouth mirror, inspect the oral tissues for any reactions that may have occurred. Ask the patient whether they are experiencing any burning, tingling, or irritation. Give the patient the postoperative instructions. The postoperative instructions are that the patient should avoid eating, drinking, or rinsing for 30 minutes after the fluoride application.